Has anyone here experienced a pain in their body that they had to go to the doctor for? Likely you have. The answer is yes, and you went and he gave you a medicine, therefore making everything better. What if when you went to the doctor, instead of him giving you a medicine that worked right away, he said he would give you one that it may take a few weeks to work, even then it might not work, and there could be side effects that are worse than what it is itself. Sounds pretty awful, right? Unfortunately, this is the normal when it comes to prescribing drugs in the mental health industry today. Doctors frequently engage in trial and error methods with no real basis in which to start. Ronnie Shapiro suffered from severe depression, saying for Time magazine in 2018 that she, quote, wanted to disappear. Over the course of 1 year, a doctor gave her 8 different medications within 4 months to no avail. Eventually, a doctor recommended GeneSight, a genetic test that would analyze her genes to tell which medication would work best for her. According to Time magazine website, she said, quote, that it saved her life as the medicine worked like a charm. Expert Dr. John Gridden, founder of the National Network of Depression Centers, talks about the genetic test used on Shapiro to Time in 2018, saying, quote, why do you want the guesswork when you can have some of the clues? My personal interest in the subject of the flimsy work that doctors do in prescribing drugs in the mental health industry began when someone I love passed away from suicide last year. So what exactly is this genetic testing, and why is it so important that we utilize it today? I will cover these 2 points very briefly with you today, and my hope is that you understand the urgency of the need for this in the mental health system. According to the U.S. Library of Medicine website in 2018, GeneSight, quote, it looks at how your pharmacokinetic genes affect your body's absorption, distribution, metabolism, and elimination of medication. Dr. James Kennedy, a molecular brain scientist, says for CTV News website in 2018 that, quote, the test analyzes cells taken from a patient's DNA or a cheek swab, and the results are then put into a color-coded list, with green meaning that the medicine to use is directed, yellow meaning used with caution, and red meaning to avoid. Does it sound like a test that's too good to be true? How about some facts on some of the results of the testing? A study from the previously cited U.S. Library of Medicine website says that 70 patients were observed, and it was found that those who took the red bin medications had more total doctor or healthcare visits and disability claims than those in the other groups. To further back this, according to the NBC News website in 2018, Dr. Charles Chamard writes, in a study done by Mayo Clinic when GeneSight was utilized, symptoms of depression were reduced by 70% than those who GeneSight was not used on them. So why is it so important that this genetic testing is accepted? The first reason is for the sake of time. As discussed earlier, Ronnie Shapiro had tried 8 different medications within 4 months. I don't know about you, but that is a lot of time to be wasting. Dr. Gridden says in an article for BP website in 2018 that, quote, the test can present the patient from weeks of riding through an unsuccessful antidepressant trial. In an article for the San Francisco Chronicle, Dr. Stephen Batke says psychiatric medication uses a little bit of guesswork. If you're seeing 10 different patients, you may start them all out on Prozac, but maybe if that, only a third will respond. Genetic testing would greatly shorten that guesswork time. The second and most critical reason that genetic testing is accepted across the board is the reduction of harmful side effects. And a staggering statistic from the previously cited NBC News website says that at least 587,000 adverse side effects were linked to antidepressants. You may offer a rebuttal and say, well, why is it so critical for mental health prescribing in particular? I give you the story of prominent lawyer Stuart Dolan as an example. According to the New York Times website in 2017, he was seeking help for his depression. He went to his doctor where they prescribed him Paxil, a very popular antidepressant. The doctor said that they would have to see if it worked. He did not receive genetic testing. He ended up developing acacia, which is a symptom, and it's actually a common side effect of Paxil. And it makes the sufferers feel as if they want to jump out of their skin, says Dr. Joanna Gretzer for the previously cited New York Times website. She also says, acacia symptoms so closely resemble symptoms of anxiety and depression that it can be hard to distinguish between the underlying illness and a side effect of the medication. 5 days after starting the medication, Dolan ended his life. Although we cannot say for sure that Paxil was the reason for this, it might be noted that his wife successfully sued the manufacturers of Paxil for $3 million later that year. Google it. Perhaps if Dolan had used genetic testing, his story could have ended differently. Both Ronnie Shapiro and Stuart Dolan are examples of how desperately something like genetic testing is needed in the mental health prescribing industry today. While it is still controversial and developing, there are reasons to be optimistic about it. Dr. Kennedy, in the previously cited CTV News article, says, quote, "Everyone is going to want this test as people soon realize the power of DNA. Widespread use of the test would reduce total health care costs due to shortened treatment and avoidance of side effects and unnecessary hospitalizations." Plans to release new supporting data in 2019 are also mentioned by Dr. Kennedy in this article. Could this genetic testing revolutionize the face of mental health care as we know it? I guess only time will tell. Thank you.